Hello, my name is Ming. I am the third-year nursing student from Group B, and my student ID is 100545189. This video is recorded for a presentation on the topic Parkinson's disease. So my partner is Tegan, and together we created the poster, and the targeted audience for this presentation would be the non-clinical background person in the community. So first, I will start share the screen. All right, so this is the poster. And as you can see, our topic is Parkinson's disease, and this presentation is presented by Ming and Tegan. So first, let's start with what is it? Parkinson's disease is a neurodegeneration disease, and it's one of the most common neurological disorders, secondary to Alzheimer's disease. And it is progressive and commonly seen on elderly. Most of the time, there's no known cause, but in lots of series, there are lots of risk factors. Unfortunately, there is no medication or treatment to cure this disease, but there are management options available to manage the progression of the disease and maintaining the activity of daily living for the patients. So basically, in Parkinson's disease, there is a decrease of dopamine level within the brain, which leads to decreased mobility. So the risk factors for Parkinson's disease would be the genetic cause. So genetics is one of the most popular theories, and the gene mutation in different kinds of genes was being found by a variety of research. And the second risk factor would be aging. Age is definitely linked with Parkinson's disease, as for the people aged over 65 has 3 times higher risk of developing Parkinson's disease compared with those people aged on their 50. Regardless of the average onset of Parkinson's disease is 35 to 55. And the next one is gender. So male has higher risk of developing Parkinson's disease compared with female. And the using of recreational drug is also associated with developing Parkinson's disease. For example, in some synthetic opioid, a toxic impurity was being found in some of the recreational drug. And also there are other theories about anemia, prejudice, lack of exercise, mid-age obesity, and gut microbiomes. The next part is signs and symptoms of Parkinson's disease. So the signs and symptoms could be clustered into 3 groups. The first one is motor symptoms, and which could be seen like tremor, rigidity, akinesia, and postural instability. So the most common characteristic type of tremor is pure rolling, which you can see the person with Parkinson's disease rolling their index finger and thumb, and it just looks like rolling a peel in between these 2 fingers. The next one is, so this for the tremor, it is a resting tremor, means it's present only at rest and diminishes with intentional movement. And for the rigidity, which refers to stiffness, it could affect on the people's posture, which increase the risk of fall. So the second group is non-motor symptoms. For example, bowel dysfunction or urinary dysfunction, and postural hypotension, and the temperature imbalance. So the bowel dysfunction is mostly common seen as constipation. So for this is it is a result of the disease process and also inadequate movement and lack of fluid intake. The urinary urgency is related to decreased mobility, especially during nighttime. The patient is rushing to the toilet, but he or her find himself or herself having a problem to getting started moving or going to the toilet. The postural hypotension is a drop of blood pressure from a sitting or lying position to standing position. So the patient will be feeling dizziness or lightheaded or having some visual disturbance. So a continuous and accurate blood pressure management is required. And also the postural hypertension is not only it's related to the Parkinson's disease process and also related to the dopamine medication, because the dopamine medication is having effects on vasodilation. So the temperature imbalance mainly appears as excessive of sweating. So the patient may feel extremely hot while others is feeling cold. There are also neuropsychiatric symptoms, which including depression, anxiety, hallucination, and sleeping disturbance. These symptoms are related to the imbalance of chemicals within the brain between other parts of the brain and the substance niger. So next part is the preventative measures. As I mentioned before, there is no cure for Parkinson's disease. However, there are treatment and management available to help manage the symptom. So the first thing would be medication. There are lots of different types of medication like levodopa, like dopamine agonist. Those medication works on different pathways to increase the amount of dopamine level within the brain. The most important thing about giving medication from a nursing point of view is timing. It is really crucial for the patient to get their medication in time, because even a small delay, like 15 minutes of delay, could result in stiffness and causing the patient suffering. The next one would be movement and safety. As we mentioned before, the patient with Parkinson's disease normally have movement dysfunction, and so continuous assessment would be necessary for managing patients with mobility. And for example, for those patients living at home, they may have problems with tripping over a rug, which increases the risk of fall. At this time, nurses should refer to occupational therapy to reassess and evaluate the home environment. So for patients with Parkinson's disease, they may have problems with speech, like they will have softener speech, and sometimes it is hard to hear. As health professionals, we should be patient, and when communicating with patients with Parkinson's disease and allow extra time to get the answer back. For communication, a whiteboard and a pen would be useful if it's necessary. And also, people with Parkinson's disease might also experience swallowing difficulties. Speech pathology should be referred to manage speech and also for swallowing problems. For example, when the patient is having a meal, the patient should be sitting upright and to avoid choking or any other risks. And also, the person may have mask-like face, like poke face, as is related to reduced eye blinking and fewer facial expression. This mask face does not mean the patient is having an attitude or disrespect or not interested in conversation. So nurse professional need to be aware of that. And the next management would be bowel dysfunction. As many patients with Parkinson's disease often having constipation problem, so nurses need to provide necessary appearance if it's required, and encourage hydration, maintain the hydration of the patient. And also, often patients will experience depression, anxiety, and which requires emotional support. So referrals to psychiatrist would be necessary not only for the patient but also for the carers, as it can be stressful for the family to manage a person with Parkinson's disease. In addition, there's a special treatment called deep brain stimulation, which involves an implantable device directly sends electrical signals to the brain and counteracts the aberrant signaling in the Parkinson's disease. So in conclusion, Parkinson's disease is a progressive movement disorder caused by the loss of dopamine-producing neurons in the brain. And looking after the patients with Parkinson's disease could be challenging for the nurses and also for the family. So we need to be patient and giving medication on time and providing necessary support for activity of daily living. And that's all of the presentation. Thank you.